Welcome to the Physicians Lounge, a podcast of the Mississippi State Medical Association. The Physicians Lounge was created to provide ease of access to information and resources on current topics affecting healthcare. This episode provides an overview of the history of medicine in Mississippi, including the Colored King's Daughters Hospital. This episode also discusses the Cornerstone Plaza project on the grounds of the Mississippi State Medical Association, which commemorates Mississippi's medical history. Joining us today are Dr. Paul Byers, Dr. Daniel Edney, and Dr. Michael Trotter. Dr. Byers is with the Department of Preventive Medicine at the University of Mississippi Medical Center and former state epidemiologist with the Mississippi State Department of Health. Dr. Edney is the state health officer with the Mississippi State Department of Health. Dr. Trotter is a retired cardiovascular and thoracic surgeon from Greenville, Mississippi, and a member of the MSMA Medical History Group. Thank you for joining us.
Hello, I'm Dr. Paul Byers. Welcome to the Physicians Lounge. Today I'm joined by Dr. Michael Trotter, who is a CV surgeon from Greenville, Mississippi, and of course Dr. Dan Edney, who is currently our state health officer at the Department of Health. And Dr. Trotter, tell us a little bit about yourself. You've become a medical historian. Tell us how you got interested in that.
Well, thanks, Paul, and it's a pleasure to be here with you today and share some of this information. I don't know that I would call myself exactly a medical historian because people have advanced degrees in that. I'm kind of what you might call a hobbyist. But having said that, certainly it's an important aspect of what I do now. As you mentioned, I'm a retired CV surgeon from Greenville, and this is almost a passion that I've encountered and undertaken over the last several years. And I've always been interested in history, like to read my whole life, but probably the turning point was when I was doing my cardiovascular surgery fellowship at the Ochsner Clinic in New Orleans. Dr. John Ochsner was my mentor, and he was had an avid interest in medical and surgical history. So he and I shared that, and really got me interested in a way that I've been fortunate in over the years to be able to stay involved in it, become involved in various groups and organizations, and been able to research and write, publish, and speak. So I'm feel very lucky, very fortunate that I've been able to do that over the years, and hopefully we'll be able to continue to do it for a while longer.
Now, back several years ago, you actually partnered with State Medical and a core group of individuals to really look at specifically the history of the medical history in Mississippi. Can you talk a little bit about that?
Absolutely. Our current, or what we have now with MSMA, and that's the Medical History Group, really started back in 2016. And it was at that time that a group was put together 2 years ahead of the 150th anniversary of the House of Delegates, annual session of the House of Delegates, to come up with a commemorative program. And the group, the core group of which was Helen Turner, Randy Easterling, Hugh Gamble, Luke Lampton, Ralph Didlake, Marty Tucker, and myself, met every month for 2 years. And we were able to put together a program and develop various projects in association with the upcoming 150th anniversary. So the 2018 commemorative program was a success in a lot of regards. The group was able to fundraise about $140,000 that the group ourselves raised. So it was no strain or extra burden to MSMA. So we were able to do that, put on the program. Haley Barber gave the keynote address talking about tort reform, talking about his experiences with Katrina. Several of us gave poignant talks about milestones in Mississippi's medical history, and it turned out to be a really good program. Luke Lampton and Karen Evers produced a book, Images in Mississippi Medicine. And for those of you that don't have it, I can highly recommend it. It's an excellent, excellent book. we initiated an oral history project, and we're doing this in conjunction with UMMC. Ralph Didlake and Helen Turner have been instrumental in that, and as you know, oral histories are kind of a mixed bag. About the time you want to take somebody's oral history, unfortunately that person either may be in ill health or may no longer be with us. So that's taken a lot of effort on their part. We've procured historic wood from around the states, various historical institutions, Whitfield, TB Sanatorium, the Afro-American Sons and Daughters Hospital in Yazoo City, and Dr. Guyton's Physiology Lab. And we're able to get wood samples from each of those places, and Irby Stewart, a craftsman in Madison, was able to build a new gavel, the current MSMA gavel. And then we were able to also preserve the previous gavels with their provenances that tell where they came from and how they were originally presented to the association. And probably the latest project is the preservation of the initial COVID vaccine materials. And Claude Brunson had those, and we were able to secure those and have them mounted and preserved. So a lot of things going on with this group, and it's been real productive. They're an energetic group, and the latest project, or the completion of the latest project, is the Cornerstone Plaza project.
Right. So tell us about that. But I'm going to tell you that group of individuals that you named, obviously there's a lot of medical knowledge in that group, and certainly a lot of passion. And I think just some of the things that you illustrated, to be able to achieve those and accomplish those is amazing already within itself. But, you know, out of this interest of history and medical history that you've had in Mississippi, some new projects have grown, and you were going to mention the Cornerstone project, which is fascinating. Tell us a little bit about that.
Well, let me back up just a second. When you say this group of individuals,
oh, yes.
I can't say enough about them. But what I really like to say is, I'm sure everybody's familiar with either usually a football team or maybe a basketball team on which you're a quarterback or a coach or something like that. When you have a team like this, you really don't have to do much, because they've got the talent, they've got the drive, they've got the leadership, and they've got the passion. So I can't thank them enough. Well, after the commemorative program in 2018, the group had such a positive experience. You know, officially our job was done. So we met to kind of a wrap-up session and kind of review and look back. And we just decided this was great. There's a lot more to do. Let's stay together. We renamed ourselves the MSMA Medical History Group. Vonda Reeves volunteered to join the group and came on board. Claude, after he became executive director, he came on board. So we were looking for new projects. It's almost like you're planning a menu. We're looking at things all the time that we can do. What are the pros and cons of it? What's going to be involved in doing it? And in 2017, while we were still the commemorative committee, one of the topics that came up was trying to preserve some of the relics of the state's medical history. A lot of it's known, but a whole lot more is unknown. Well, in Greenville, I had always heard that there was a cornerstone of an old hospital. It was named the Colored King's Daughters Hospital in Greenville, and it was behind some apartment buildings laying in the dirt. And you hear that story, but you don't really know. So I thought that might be a good idea. That's a relic that we could maybe preserve. Of course, we didn't know what we were going to do with it. We didn't know how we were going to get it. So
you really had to do some field work.
We did. And that's where the field work, the legwork kind of began. I was able to contact a couple of longtime Greenvillians, and sure enough, we went over, we found it. It was located on the property where this hospital had stood. And when the hospital itself, the building was demolished in 1971, the cornerstone was just kind of left there. Now the owner, Dr. Noble Frisbee, he realized there was some historical significance to it. He could have had it busted up for landfill.
Right.
But it was left there. but nothing had been done in 46 years because the building was torn down in 1971. So I was able to contact the owners of the property, and it was still in Dr. Frisbee's family. An apartment building is there. It still operates today. So we went over, we identified it. It was in the back by an air conditioning unit lying in the dirt. Amazing that it survives since 1908.
Unbelievable.
And we contacted the owner, the family, and through their legal representatives, we were able to have it donated to MSMA. So that was really the first step, was to get it donated. So MSMA now had ownership, and fortunately, we contacted Delta Regional. Could you help us move it? Could you help us store it? And they were real good about it. They provided the resources and the crew, and they were able to move it. It's really heavy. It took rollers and a forklift and a trailer. Stored it in the warehouse, and which is where it sat for a couple of years. Hugh Gamble went over and identified it, authenticity of it. And after the commemorative program, it surfaced again. We've got this. What should we do about it? Maybe we could just get it moved to Jackson, and we could put it out between the azalea bushes around here or something, just kind of as a discussion piece.
Right.
But Claude really had the idea. He said, now, wait a minute. If we're going to do this, let's go first class. And so everybody got excited and enthused about that. And so that began dialogues with landscape architects, and another fundraising committee was initiated, and everybody was on board with it. And we went through several months of planning and fundraising, and were able to raise about $150,000. And so Claude, and I can't say enough about the team here at MSMA. I mean, they absolutely were on this and enthused about it. And so got it designed, got it built, got it moved. We broke ground in August, and I believe we dedicated it in November. So, and the plaza here is if you haven't seen it, next time you're in town or Jackson, it's worth just driving by, park, get out, and just look at it.
Absolutely. We encourage folks to do that.
It's right now we're in the process of hopefully having a Mississippi Department of Archives and History historical marker placed there.
Wow.
To honor the cornerstone. So really the only thing left to complete this is the story, right? The story of the cornerstone. Because if you have a relic or an artifact without context, it's kind of worthless. But
you've pursued that as well. And retirement has not been slow for you so far.
Well, it's this is one thing that, of course, I get excited about, because to me, researching these stories and it's almost like looking for buried treasure. And when you find something that you've heard about for years, right, or in the neighborhoods, around the hospital, in town, and that's wrong, because you have the document in front of you with the date and the time and the person who said, actually, he said this, although you've heard for years it was this. So it was, I decided that, if we're going to tell the story, we need to really kind of feather it out and see exactly what the real story was. I didn't know there was going to be very much to it. But what I was impressed with first was where there was not any information. The usual sources, Department of Archives and History, the County Board of Health, Health Department records. There's just nothing there, because it was so long ago before people kept those kind of records. Or records, attics have been cleaned out. I know that was the case in Washington County Board of Health. They had boxes and boxes of records, and probably about 5 years before I showed up in 2020, we'd cleaned the attic out and all that stuff went in the dumpster. So that's not unusual. It happens. But we were, fortunately, there are oral histories, there are court records, there are city and county records, city council minutes, board of supervisors minutes. And by really looking through all that, you can really piece the story together. And there was a whole lot more to this story than I would have ever imagined.
So can you share a little bit of that story with us? I know that you've been you've been deep in trying to put that together and do some writing, but can you share a little bit of this history to us and how that significance of that cornerstone and why it's so important for us to remember this?
Well, I think when you look at the Mississippi's medical and surgical history, there are indeed some fascinating stories. And stories like this one are simply one of the ones that would have fallen through the cracks. I mean, it was just, oh yeah, I remember that old hospital, it was over there. Seems like it was always busy, but never really heard much about it. But when you go into the oral histories and the city council minutes and the board of supervisors minutes, you really see that traditionally at that time in the state's history, probably in the whole country's history, we're talking the early 1900s, segregation was the law of the land. Racial segregation divided healthcare into black facilities and white facilities. And those racial boundaries were rarely, if ever, crossed. Most every facility was either white owned and white operated, or black owned and black operated, or white owned and black operated. But what I've never seen a case of is a facility that began as a black owned, black operated hospital that over the years evolved to a black owned and white operated hospital. And so that's real unusual in the context of this time period. And I think another thing that was a turning point in the 1930s was when this hospital was a Mississippi State Supreme Court case. Now that was a real interesting story. And it was the short version of it is simply that the hospital was incredibly important to the local government, right? The city
Right.
and the county, city of Greenville and Washington County, because you had a huge African American population because the whole Mississippi Delta economy is based on cotton.
And this hospital served a huge surrounding area.
It did. Everybody that came there. Now, interestingly, it started as like I said, a black-owned and black-operated hospital, and it evolved to a black-owned and white-operated hospital for non-white patients. So, originally it was African-American patients, now it's non-white patients. And non-white patients included Chinese and Hispanic patients. So, as this evolves through the ladies of the Colored King's Daughter Circle Number 4 were the ones who originally, the evolution was from a home, which was not unusual in the late 1800s, early 1900s, a home for the infirm and the elderly. And then it evolves into somewhat of a healthcare facility. And then it evolves into a hospital of sorts. And then it evolves into an actual hospital with operating rooms and dietary departments and nursing staffs and that kind of thing. So in the 1930s, there was some friction between how the city government was administering the hospital and what the ladies of the Colored King's Daughter Circle Number 4 perceived as their mission to provide health care. And that's what led to the appearance before the Mississippi Supreme Court. The lower court had ruled in favor of the ladies in terms of being in control of the hospital, and it was appealed to the state Supreme Court by the managers, the local government appointed managers of the hospital. And then the state Supreme Court ruled in favor of the Colored King's Daughter Circle Number 4. Once that was accomplished, the circle itself seemed to fade from the historical record, not unusual for organizations over time. And that's when they reached a leasing agreement with the Gamble Brothers Clinic in Greenville. And from that point on, they would administer the hospital and continued to staff it all the way until it closed in 1953, one other tidbit, if you follow this story from the 30s through the opening of Washington County General Hospital, and you follow the story through the need for more hospital beds,
Right.
and the formation of the Mississippi Hospital Commission, and the push to provide some type of insurance product for rural areas. And it's amazing that this hospital, as it was, this small house-appearing hospital, is the actual ancestor of what today is Delta Health. It was the forerunner of Washington County General Hospital, because as originally set up, the need for more hospital beds initiated a movement that would put 100 new beds at the white King's Daughters Hospital in Greenville for white indigent patients, and a 200-bed African American hospital. Now, as it went through the state legislature and funding, and the Hill-Burton Act in 1946 came in, things evolved, things changed, and eventually the hospital evolved to simply a 200-bed hospital, 100 beds for white patients, 100 beds for African American patients, segregated, but it had to be separate but equal. And one other important factor in all of this was a Pulitzer Prize-winning journalist, Harding Carter.
Mm-hmm.
And Harding Carter was the editor of the Delta Democrat Times during this time. He came to Greenville in the early 1930s. And his efforts and his editorials really helped move this along. So I think with the leadership, the need, obviously, the leadership of Harding Carter, the leadership of Hugh Gamble, who is our Hugh Gamble's grandfather. The Washington County General Hospital was founded, and the Colored King's Daughters Hospital was closed. It was converted. It was bought by Dr. Noble Frisbee, a general practitioner in Greenville for many years. He turned it into apartment buildings. And in 1971, that original building was destroyed, and the current apartment building was built there.
But the cornerstone survived.
The cornerstone made.
And I think it's interesting to think about, what this boils down to was achieving access to care, access to quality health care. And fast forward decades later, and the discussion about access to health care remains, and access to good quality insurance for rural areas remains. So, with that kind of context, why is it important for Mississippi physicians to understand this particular story, but medical history of Mississippi in general as well?
Well, you hit the nail on the head about access to health care. When you follow this story, that's really what it was all about. And Hugh Gamble began as early as 1937 trying to figure out a way. He knew that this system as it was would not be sustainable. And so access to health care, and especially, like you said, quality health care, was of paramount importance. Hugh Gamble was very involved nationally with the American College of Surgeons and their hospital classification. And so the care that was received there was a direct reflection of the nursing staff and the physicians that worked there. And when you look through this, one of the things that we have preserved in the 1930s and 40s, Hugh Gamble made a series of operative movies. And those movies are now held in the archives of the American College of Surgeons. But it's a video record of the type of health care, the quality of health care that was being attempted during this time period. So when you look at this, I think it's incredibly important to look at this struggle for health care, how it's evolved, where we are today, and it really provides context to what we're doing today, to what everybody is seeing in their work and in their practices every single day. The problems that we face, the problems that we we read about, the problems that we hear podcasts about every week and every month. So I think in that way, knowing our history, which is our professional history, enables us to do that, enables us to have these conversations, enables us to, let's don't repeat what's happened in the past. They were looking for a better way. So if we've got these problems, we've still got to look for a better way. But I really think it's important in this day and age that we all know at least something about our professional history. Now, it's not for everybody, and I totally get that. Advocacy is incredibly important in today's world for what we do. I'm probably the last person you want on the advocacy committee.
It doesn't sound like it, but okay.
It's just not my cup of tea. So I get it, but realizing the importance of where we came from and how we need to continue into the future with all the challenges we're facing. And the challenges we're facing today are not completely unlike challenges that were faced 100 years ago. They didn't have the technology, may not have had all the knowledge, but the issues were clear and present, and they had to deal with them every day, just like us, just like we get up every day and have to deal with them. So I think that's what's really important, and to recognize. And simply put, Mississippi's medical and surgical history is simply fascinating.
So you've piqued the physician who's listening. You've piqued his interest. How does he get involved? What if he is interested, he or she, and want to pursue understanding a little bit further? What are some recommendations you have?
Well, the first thing I would recommend is in the next issue of the journal is Kathleen and her team have been so great to put out a special issue of this story. So I would urge you to read the story of the Colored King's Daughters Hospital and see if indeed it does pique your interest. And then if you're interested, we would love to have you join us. Just contact us through here at the MSMA office. We're always looking for new projects. We're always looking for people who would love to work with us and join the committee and be a part of it, because you are a part of it.
Even if there's some local history that you're aware of in your area that you want to explore further, give you a call.
Absolutely, right? Because those are the stories. Those are really the stories that make this. And our job is, none of us are professional, what are known as professional historians or academic historians, but we're all clinician historians. That's the category we all fall in. And these local stories, you'd be amazed at the far-reaching impact of that a local story can have. But the most important thing is that story has to be told. So if there is a story and you feel the story is important and you want to tell that story, this is a grand opportunity to do that.
And excited about the new issue and coming out. And when will that be out? That'll be out next month. So we look forward to that and reading more about the history of the hospital. And I think you said something, and you had mentioned it a moment ago, about doomed to repeat mistakes in the past if we don't pay attention to our history. And I think that's certainly something that we all need to remember. And particularly interested about some of the COVID vaccine that you've managed to preserve for posterity. And I know that was near and dear to our heart, Dr. Edney, when we were fighting that battle. And Dr. Edney, what are your thoughts as we talk about the medical history in Mississippi?
Well, first of all, as a medical history consumer, not as a historian, but certainly as a consumer, and having the privilege to be in the seat which has historically been the center of Mississippi professional medical history, going back to 1877 with the establishment of the Mississippi Board of Health, and then in 1982 the formal establishment of the Mississippi State Department of Health. So much history has flowed through there, and going back to the history of the Washington County Health Department, as Dr. Trotter was outlining, that goes back in those days. public health was county-based in terms of physicians, that every county had a public health officer. Well, Lord, we only have 4 for the whole state now. So it was a very different world of public health, at the turn of the 20th century versus where we are in the 21st century. But it appears we're trying to circle back around and repeat some of that history. And I appreciate those who work to preserve history, but history, unless we're going to learn from it and grow from it and build from it, is just a bunch of interesting stories. But for it to be impactful, we have to learn from it. So here is a tidbit that's pertinent for today as we deal with Medicaid expansion, which I consider to be the singular most historic event in Mississippi medicine since tort reform. And I would challenge anyone to counter that fact. And we've not decided what we're going to do as of today. But I would remind everyone that Dr. Alton Cobb, who was state health officer in the late 60s, early 70s, was impactful in us finally accepting traditional Medicaid. We were the last state in the United States to accept Medicaid. And poverty was even worse back then. And the conditions in Mississippi Delta, as a Greenvillian myself, it's bad enough now, but it was horrendous back then. And it took Governor John Bell Williams, I believe, to finally come around to accept Medicaid. We were the last. I'm praying that we're not about to repeat history with expansion as we try to provide access to care for our low-income Mississippians who work hard every day, like my mother and father did in Greenville, Mississippi. Part of medical history for me relates to King's Daughters Hospital, the main King's Daughters Hospital, where my father died of colon cancer in 1977, at the age of 54, with no insurance, working hard every day until the day he died. He achieved health care at King's Daughters when he was so sick there was nothing else to do but take care of him as he died. I am alive today because I have health insurance, because I was high risk and I was screened at the right age and found to have the genetic predisposition my father had. The difference was I had access to health care, and my adenomatous polyps were removed and have been ever since then. And at age 62, I'm not going to die of colon cancer like my father did. It relates to access to care. And what I love about the story of Colored King's Daughters Hospital is it's a picture into the fledgling movement. You can't really say health equity, but it was attempts at some semblance of equality.
One of the beginnings.
One of the very beginnings. But it led us, on the path towards where we are today to try to achieve health equity, which we're not there yet. But folks in Greenville, Mississippi, Washington County understood back then, that a segment of the population was not being served. They deserved to be served, and they made attempts at serving them. I think we're very much in that discussion today, that many of us feel that there's a segment of our population who are not being served, who deserve to be served, and we're making attempts to see that they are served. Those of us at the health department see it every day, as you well remember. In private practice, for over 30 years, I didn't see it every day, because I was seeing the folks that had access to me. And I saw it in the hospital with the folks that were being admitted under EMTALA, and doing our part to take care of them. But I wouldn't see, they weren't in the clinic nearly as much. I saw them in our free clinic, and, which were our attempts in Warren County to try to have some degree of health equality for the working poor. So it's gone from being an issue of segregation to being an issue of true socioeconomics. And the number one driver of your health outcome is your zip code. And so those of us...
And it shouldn't be.
And it shouldn't be. Dr. Trotter and I both live in unfavorable zip codes. That 39180 in Vicksburg is an unfavorable zip code. So West Mississippi zip code means you're much more likely to die prematurely, than your zip code, Dr. Byers. And it shouldn't be that way. It's pivoted now to where we're dealing with rural versus urban Mississippi. And when you look at the health outcomes of rural Mississippi statewide, the outcomes fall off. Mississippi Delta is 15% worse outcomes than the rest of the state, and the rest of the state is not magnificent by any means. And Southwest Mississippi is not far behind the Delta, and I'm right there in Vicksburg serving the South Delta and the northern part of Southwest Mississippi, so seeing both worlds. But as I look as state health officer at outcomes around the state at various regions, the rural areas of Northeast Mississippi aren't doing well. The rural areas of East Mississippi and the Pine Belt aren't doing well. They're doing better than the Delta, but they're not doing nearly as well, as rural Minnesota or rural Michigan.
Right.
And as we look at health equity in Mississippi, we really need to be looking at the entire population. Because when you look at our entire population, white, black, Hispanic, Native American, Vietnamese, our entire population has severe disparities with Massachusetts, Rhode Island, Delaware, California. And why is that? It's not because we're more ignorant, and it's not because we're genetically predisposed to die earlier than everybody else. Poverty still drives a great deal of what we have. So, learning from our history of what poverty has done and the impact of poverty and the impact of poverty in different regions, and learning from that and saying, okay, so we've been doing this for 50 years and this is where we are. Shouldn't we try something else? I mean, good grief, what could it hurt to try something else? It can't possibly be worse. And to stand on the shoulders of the giants that went before us, who did the hard work in the 1910s and 1920s, 30s and 40s, when there wasn't a lot of support, but people were doing it anyway. And then into the late 1940s with the Hill-Burton Act, as Dr. Trotter outlined, which basically the federal government said, we'll build you a new hospital. You got to take care of the indigent population. You must.
Right.
And you're required to, which it's interesting as you watch a lot of these old Hill-Burton hospitals unwind and become something else, that mandate is still there. So those needs are supposed to still be fulfilled. But and as we move into the late 60s and 70s with the advent of Medicaid for the impoverished, and since the early 1970s, we're doing better in Medicaid. We're providing more access than we ever have with Medicaid, but it still is not able to get us all the way there. And so looking at alternatives of when we have 200,000 Mississippians without adequate access to quality health care to prevent the outcomes of my father, we have to do something differently. And to do something differently, you have to know your history, I think. And I've been preaching this legislative session that hospitals are absolutely necessary. They must be healthy. We must invest in them and take care of them. The hospitals do not change the health outcomes. It's the doctors and the providers and the access to primary medical care. We've proven over and over again that changes outcomes. So you want to reduce colon cancer deaths, you provide access to that hospital's outpatient services so that our folks are being screened and identified early and treated so they never get colon cancer like my treatment has achieved. But you have to have access. Had I been in my father's position, as so many Mississippians are today who go to work every day, I would have had to survive until I'm 65, somehow or other, which is what my father was trying to do. And I wouldn't have made it. I would have died probably in my 50s as he did. This is unnecessary, so history is so important. I try to learn from the history of the health department. We have minutes from the Board of Health going back. I know we have handwritten minutes we're preserving that go back to just before the turn of the century. We have printed minutes from the county boards of health that are fascinating, in the 30s and 40s, those printed editions that we have.
I promise I wasn't working at the health department at the turn of the century.
And one project we have that's going now is to look at the history of public health in Mississippi. And I have our communications department going back to 1877 and beginning documenting the main actions of the Board of Health. And so as you come in to our central campus, as you come into the Cobb Osborne building, that long hallway you will remember that's blank, very soon that those walls are going to tell the story of public health as you walk down that long hall. And then coming up to the fourth floor, we're going to tell the story of the state health officers, and there's only 10 of us, and then the boards of health, most recently. And, we have so many fascinating artifacts. We have that vial of vaccine that you and Thomas were vaccinated from.
Amazing.
Archives and History's not getting that. There was a stack of photos in my office, and I'm going through them, and they go back showing county health departments back from the 30s and 40s. And I found a picture of one of the old TB mobile units. That was basically just a converted bus that would go around the state doing TB work.
I'm doing mobile chest x-rays.
Yeah. And now we have our brand new mobile units coming online to do whatever we need to do in all of our programs. Have the picture of the OTB mobile unit versus one of our new mobile units. Just telling the history of public health. Very few people know who Dr. Leathers is. We would consider him the first state health officer. Mm-hmm. And there's an award at UMC for the top graduate of the School of Medicine named in his honor. It's the Leathers Medal. And he was the first director full-time hired by the Board of Health. And then you have Dr. Underwood, who followed him, who won the ultimate award in public health at the national level, not once but twice. It's like winning the Nobel Prize in public health, not once but twice. And then we have Dr. Cobb, Dr. Ed Thompson, Mary Courier, Thomas Dobb, and now this reprobate. But that history is very rich, and I'm working to preserve that part of it. I came across Thomas's notebook through the pandemic, and he had left it behind. Well, I've taken care of it. And
just delete any references to me.
I'm pulling together books and awards going back to Dr. Cobb. Anyway, I have the Cobb family gave us several of his awards. I need some things from Ed Thompson. Mary and Thomas are pulling some things together, but just showing that lineage of public health and the importance of the Board of Health in our system, and the importance of the Mississippi State Department of Health, and so many aspects of modern day medicine in Mississippi, but also trying to achieve health equity and access to care for the least of these.
Dan, that's fascinating history, and I hope we can look forward to an article by you chronicling the great history of the Board of Health for an upcoming issue in the journal. And it sounds like, Paul, that might be a good a speaker and a topic for our annual history lecture next year at annual session.
It certainly does, and
Serves me right there.
I think it illustrates, first of all, a story that needs to be told, but also the fact that we still have a lot of work to do.
Yeah.
And we talked about some of the situation in the 30s and 40s, and here we are now, and we appreciate the good fight that you're fighting for the people of Mississippi, and keep up the good work. And I guess as we've covered a lot today, but as we wrap up, any final thoughts before we part?
Yeah, I just want to applaud so much the work of the Memorial Plaza, and at the office, I call it the Memorial to Health Equity, because that's how I see it. That first little glimpse of some equity work, that was when we didn't even know what it was back then, but and that's why it's important that we want to be a part of it, because it needs to be recognized. And I just really commend Dr. Trotter and the History and Medicine Work Group and the Medical Association, because had y'all not done that, that's lost history. Absolutely.
It would have been. It would have been just one of those things that simply went through the cracks and fell by the wayside. But I think that probably the simplistic truism of this whole story is the fact that when you go back to the beginning, it's just like Dan said, and you follow the story, follow it through the 19-teens and the 20s, and you follow it through the Supreme Court decision and the transition administration, the 27 flood. I didn't mention that today, but it had a huge impact on the story.
Absolutely.
It'll be in the article. But that was important as to how those issues were navigated. But one thing never ever came up during this whole time, 1908 to 1953. There was never not one instance of anybody saying, we're just going to close it down. The means and resources were always found from 1908 to 1953 to keep that alive and to keep it moving forward. And I think that was one of the most surprising things I learned from this. Not one time did anybody ever mention, we just need to close it down.
I think the key to that was moving forward. And I think we have opportunities to move forward, and hopefully we'll continue on that track. Any last thoughts before we wrap up?
Well, I do want to thank you for inviting me down today, giving me the opportunity to talk about not only this project, but the medical history group, itself. And I would just encourage everybody, if you're interested in this, to get in touch with us, and we would welcome your input.
Thank you for joining us, Dr. Trotter, Dr. Edney.
Thank you.
Thank you.
And hope everybody has a great day.
Thank you for joining us. Show notes for this and MSMA's other episodes are on podbean.com or on msmaonline.com. Support our show by subscribing and leaving a review. Thanks for listening, and see you next time. Brought to you by MSMA. We are the physicians who care for Mississippi.